Anesthesia-free dentals are this new thing that people are getting interested in, and essentially there's a lot of things I need to debunk here so that you don't get pulled into this really terrible thing for your pet. So why are people doing anesthesia-free dentals? One thing is if you have an older pet that you are concerned about going under anesthesia and you think that's risky, then you want to do this. I'm here to tell you that it's more risky to do the anesthesia-free dental. Number one, we're going to hold the pet down, right? So they're going to hold the pet and then they're going to take sharp instruments and go in their mouth and peel off all this plaque that's been sitting there for years or however long. And, you know, because we know we don't brush our pet's teeth every day, even though we should. So they're going to go in and they're going to start plucking away at all this plaque. That is painful. You know, they just do a really good job of not showing us that they're in pain, but it will hurt if you do that. So we're stressing them out, okay? So you're gonna stress a pet that may have like heart disease. So stress can actually push these guys into failure of organs. It can make them wiggle and, you know, fight, and it makes their anxiety levels higher. Senior pets already have higher anxiety levels because they don't have the ability to calm themselves down with serotonin and dopamine. So no, just that is absolutely not ideal. Second, we are taking a very sharp instrument and we are going into the mouth. So that being said, trauma very well can happen if they're doing it the way they're supposed to, but we are going to pluck a bunch of stuff off of the gum line here. If we pull all that stuff off, there's a good chance there's pocketing that's happened from the layer of plaque into the gum line. So it's kind of created like a pseudo covering, if you will. So now we're going to pluck that off if we are able to safely. And we're going to make the gums bleed, and we're going to open up this area into the tissue under the gum and the roots. They're going to be exposed, and then we're going to get infections because we can't clean under there because they're not going to let us get under that gum line and clean. Something people don't really know is that if there's a lot of plaque buildup on the teeth, there's a really good chance that the underlying roots are already affected. There actually is often lysis of the bone or breakdown of the bone under that gum lining. So if we're holding these guys down and we're going under that gum line, there is also a really good chance that we could break parts of the mouth. So you can actually break the jaw doing this because they are awake and fighting us and painful and all of those things. So I don't recommend this.